Good morning. My name is Liam Bedard, and I'm the Executive Director of PsyCan, the trade association of Canadian psychedelic medicine and therapy companies. We are healthcare practitioners, researchers, drug developers, and suppliers advancing evidence-based psychedelic therapies administered by qualified professionals to treat mental health. We're honored to stand with Canadian Armed Forces veterans, first responders, and patient access advocates in meetings with members of Parliament this week. Together, we're calling for an end to denials, to delays, and to out-of-pocket costs for life-changing and life-saving psychedelic therapies. Numerous landmark scientific studies show psychedelic therapy can outperform first-line treatments for depression, anxiety, addiction, and PTSD, offering durable, intermittent care instead of a daily pill for life. Recent polling by Abacus Data shows a majority of Canadians support these therapies, with only 1 in 4 opposed. And yet, despite a national mental health epidemic ravaging communities from coast to coast, despite the 10 to 15% of Canadian veterans living with post-traumatic stress disorder, and despite a 2023 Senate report urging that the time is now for a large-scale federal research, Health Canada and Veterans Affairs Canada have decided to wait and see. Wait and see from Veterans Affairs Canada as reimbursement for psychedelic-assisted therapy is refused as a matter of policy. Wait and see from Health Canada as the Special Access Program keeps doctors and patients in limbo. Approvals for psilocybin and MDMA slow, unpredictable, and unsuited to meet growing need. Wait and see from the Canadian government as we backslide from leader to laggard, while the United States makes major research investments and Democrats and Republicans unite in a rare bipartisan consensus on regulatory reform. But there is a growing chorus of voices rising to answer that tired refrain. The Senate Subcommittee on Veterans Affairs is calling on Veterans Affairs Canada to lead, not lag, on novel therapies for former CAF members. Their message is clear. The time is now. Doctors being second guests and patients waiting for months in a special access program that has become hallway medicine for mental health. They say the time is now. And an emerging psychedelic therapy sector, scientists, physicians, clinicians, drug developers, and suppliers stand ready to lead a made-in-Canada global healthcare revolution. We say the time is now. And with that, I'd like to invite Master Corporal Josh Veinotte, retired, a Canadian Armed Forces veteran with 2 combat tours in Afghanistan, to the podium. Josh.
Good morning, everyone. Thank you, Liam. As mentioned, my name is Josh Veinotte. I served in the Canadian Armed Forces for 14 years. I joined when I was 17 years old and deployed in my first combat tour by the time I was 21 years old. When I came home from my first deployment, I could barely sleep. The nightmares were relentless and extremely visceral. I was constantly exhausted, I had no appetite, and I struggled with emotional regulation. I pushed through for almost a decade like that, living on a cocktail of medications that only made things worse. I felt sedated, disconnected, angry, and deeply depressed. Eventually, in December of 2016, I released from the Canadian Armed Forces simply because I could no longer handle the weight of depression and anxiety. I was completely unraveling, and I felt I was no longer effective as a soldier. After being released from the Canadian Armed Forces, my mental state got even darker. I was completely lost and emotionally numb. I battled suicidal thoughts every single day. I felt zero connection to anyone, even my family, who I'd always been very close with. I chased adrenaline, engaged in intense workouts, dove deep into therapy in an attempt to understand my own mind, yet I was still numbing myself with drugs and alcohol. I desperately wanted to feel anything other than the weight of depression. After a lot of research, discussion with clinicians, and speaking with others who had seen the positive benefits, I decided to use psychedelics in a medicinal setting. For the first time in almost 15 years, I felt peace. It was as if I could see all the traumatic incidents and chaotic events of my life somehow making sense, like they all had a piece in a larger pattern. It also provided me with an overwhelming sense of gratitude for the present. That experience allowed me to forgive myself, reconnect with my family who I had drifted away from, and gave me a brand new outlook on life. My story isn't unique. It mirrors tens of thousands across Canada, So I'd like to pose a question. When we think about why we support our veterans, our first responders, and our healthcare providers, what do we envision? What's the real reason we support them? We often picture a hero, a protector, a healthcare provider, and people who run towards danger when others run away. And that is true, but I also see something deeper. I see men and women who embody the very values that define our nation: honor, integrity, selflessness, courage, self-discipline, loyalty, and a calling to serve the greater good of humanity. These principles uphold the very fabric of our society. Yet far too many of these people carry invisible wounds that make them feel isolated, misunderstood, and disconnected from the communities that they once served. When we lose these people to isolation, addiction, and suicide, we don't just lose the individual, but we lose the strength and the moral fiber that they brought to our communities. We are calling on the federal government to immediately investigate and hold hearings into medical access for psychedelic medicine, with an eye to regulatory reform. A solid move in this direction will save lives. The time is now. Thank you.
Thank you, Josh.
Excuse me.
I now invite Master Corporal Gordon Hurley, retired, an advocate for safe veteran access to psychedelic therapy, and a former Canadian Special Operations Forces Command operator with multiple deployments in Afghanistan, Iraq, and Africa. Gordon.
Good morning. My name is Gordon Hurley. I spent 15 years in the Canadian Armed Forces, half as a light infantry airborne reconnaissance patrolman, and the other half as a special operator and joint terminal attack controller. I've had a combined 11 surgeries during service and post-service, as well as the litany of mental health issues that come with the occupation and combat operations, such as post-traumatic stress disorder, depression, substance use disorder, a suicide attempt, and suicidal ideation. I've used psychedelics combined with assisted therapy to get me to a point where I'm at the Parliament Hill at a press briefing, able to eloquently speak about my experiences with psychedelics. This should be enough. The Time Is Now was a report that was written 2 years ago this November. The recommendations from this report go that the Veterans Affairs Canada and the Department of National Defence, in collaboration with Health Canada and the Canadian Institute of Health Research, as well as the applicable provincial and territorial authorities, immediately launch and fund large-scale research programming on psychedelic-assisted psychotherapy for those treating mental health disorders and other conditions that have been identified as potentially being therapeutic targets for these types of interventions. It's been 2 years. If we take historical data around veteran suicide, we can project suicide numbers. Rough estimates put between 270 and 280 veterans killed themselves in the last 2 years. That equates to one veteran every 3 days. Now you might say, Gordo, those are projections and those numbers will have variable to them. And I agree with you. And my question to you then is, what number is good enough for you? What is it going to make it easier for you to swallow? One every 3 days? One every month? One every 2 weeks? I would like to know. I would also like to know and bring to attention that one of the most conservative states in the United States of America, Texas, passed into legislation a $150 million bill into the research of ibogaine for opioid use disorder and post-traumatic stress disorder among veterans. I'm extremely confused to how one of the most conservative states in America can be light years in progression with the treatment of mental health than our great nation of Canada that prides itself on our progressive nature and values. All I'm asking is for the recommendations that were given to us by the federal government in a report that they made to be actioned. I'm not asking for anything else other than for the government to follow their own recommendations. Thank you.
Thank you, Gordon. I now invite Nicholas Pope, a human rights litigator with Hameed Law, to speak about Health Canada's Special Access Program. Nicholas?
Good morning. I'm a lawyer who represents dozens of patients and more than 200 healthcare practitioners, including doctors and therapists, seeking access to medical treatments with psychedelics. The current Special Access Program, which is the only way to access these medicines, causes a lot of harm. It harms patients, doctors, and the taxpayer. First, it harms patients with delay and uncertainty. Health Canada takes months, sometimes even up to a year, to assess these requests. And patients go through the stressful experience of not knowing whether the treatment that their doctor has recommended will be refused by a government official. And this government official is not an expert in mental health, does not have a clinical relationship with the patient, and unlike a physician, is not governed by a professional college. These delays and uncertainty exacerbate patients' mental health conditions. Second, it harms doctors. It burdens them with an enormous amount of paperwork, giving them less time to treat other patients in an already overburdened healthcare system. And finally, it harms the taxpayer. The Department of Justice wastes a lot of resources fighting patients and doctors in court. The government has already lost in court once after refusing a request to treat cluster headache patient Jody Lance. And just like with medical cannabis, it will keep on losing because the charter right to make reasonable medical choices is much broader than the narrow Special Access Program criteria. Health Canada also wastes a lot of resources writing lengthy refusal decisions instead of simply approving the treatments recommended by doctors. So what is the solution? The solution is a system that makes doctors the decision makers, not the government. And this sort of system will protect patients' health and safety and reduce the workload on doctors and Health Canada. Thank you.
Thank you, Nicholas. With that, I'd like to ask Nick Kadysh, the CEO of PharmAla Biotech, to speak on the perspective of Canada's psychedelic medicine and therapy sector. Nick?
Thank you very much, Liam. My name is Nicholas Kadysh. I'm the CEO of PharmAla Biotech and a former board chair of PsyCan. Our company provides MDMA into the Special Access Program, as well as supplying clinical trials to organizations such as the U.S. military and the U.S. Department of Veterans Affairs. Canada is unique in that we have a regulatory system that places a bureaucrat in between the doctor and the patient. This is not a system that exists anywhere else in the world. And we are here this week calling for regulatory change, beginning with a Section 56 exemption, allowing mental health professionals and prescribers to prescribe MDMA and psilocybin to their patients. This currently runs through the Special Access Program, which is not fit for purpose. We're also asking for regulatory changes to be made to the Food and Drugs Act at the same time to allow this to move forward. Simply put, we should not have untrained bureaucrats in Ottawa second-guessing decisions made by mental health professionals. It is simpler in Canada to access medical assistance in dying today than to access MDMA or psilocybin, treatments which have been shown in both real-world evidence and in over 10 clinical trials to be highly effective. So we're calling on these changes to be made immediately, and for the Time Is Now report, which was issued by the Canadian Senate back in 2023, to be fully implemented as soon as possible. Thank you.
Thank you, Nick. Are there any questions from the media?
For the journalists joining on Zoom, if you have a question, please use the raise hand function. Pour les journalistes qui se sont joints à nous sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Thank you. That's
I gotta ask you a question.
Yes.
On the Hill, do you guys have any ins with MPs or any parties that are willing to help you with your project?
Absolutely. So we'll be meeting with some 25 members of Parliament and senators from the Liberal, Conservative, and Green parties over the course of our week here.
But has anybody come forward to say that they're going to support your project? Or
Absolutely. So we have deep cross-party support from a variety of members of Parliament and senators, and we're going to be hopefully picking up some new friends and allies along the way. Later today, we'll be meeting with Senator Hassan Youssef, who is a co-author and a member of the Subcommittee on Veterans Affairs that issued the Time Is Now report, among others. Yes, of course, Nick.
I will also say, I mean, if we want this to move forward faster, which is what I think we all agree our veterans and our first responders deserve, this requires a Government of Canada response. And while we do have a lot of friends and supporters in Parliament and in the Senate, we believe that it's time for a whole of government approach to combating the dual mental health and substance use crisis that is seizing our country today.
Thank you. This concludes the press conference.
Thank you
Merci,
very
c'est ce qui
much.
conclut cette conférence de presse.
Cheers.